Yeah, that's like the one seat that's kind of in the way. Appreciate it.
Okay. Yeah, I hit live and it said live and then I went to the restroom, so I didn't have any reason to think that it wasn't live. It said live on the backside. I never want to wait till it says live, so I don't know what to do. Yeah. Yeah. I mean, I hit close from it, so I don't know. Yeah, that's the reason that I went back to check because I came back from the restroom and looked and saw that it said controls and went to grab my phone and I was like, oh. Okay. All right. Sorry for being scared. All right. Bye-bye. Not live. Oh, yeah. The new director of taxation.
Good afternoon, and thank you all for being here on this beautiful Mississippi Friday afternoon. We have been up at this table day after day, highlighting the public health crisis that we face. We know that this is historic. Our country hasn't dealt with a pandemic of this magnitude in over 100 years. We have also tried to shine a light on the economic health of our state, and we've also tried to shine a light on the human cost of the historic rise in unemployment. Today, I want to focus on an aspect of this crisis that has too often gone unaddressed. There are severe mental health challenges going on as a result of this virus. There is fear, there is pain, and there is anxiety in this country and in our state, and those cannot be overstated. Some of that is legitimate fear of this virus. Some of it is anger at the place we find ourselves in. Some of it is restlessness and anxiety that is natural when we remove in-person gatherings, sports, movies, togetherness. There is a reason that our community includes so many activities that became non-essential when lives are on the line. But we cannot ignore the cost of abandoning them. This country is on edge. We have to recognize that, and we must be prepared to deal with it. We cannot pretend that everyone is doing just okay. We need to face that depression, anxiety, and fear that are plaguing us. First, from me to anyone listening who needs to hear this, do not give up. Do not give up on life. Even if you do not feel it today, you are valued. You are loved. You are needed. This state needs you to get up every day and be yourself. We need you to bring your unique light to this world. We are a better place because of you. I'd encourage everyone to reach out to people that may be experiencing isolation and loneliness. Those are powerful diseases of the mind. They are, too often, deadly. Please, to my fellow Mississippians, show some extra love today. Show some extra kindness. And please be willing to show empathy to anyone you encounter, and make an effort to reach out to those who may need you. I asked a few of our leaders who are doing important work in this arena to join us today. First, I'm going to turn it over to Wendy Bailey, who is our Chief of Staff at the Mississippi Department of Mental Health, to go over some of the resources that are available to anyone who is struggling emotionally or mentally in this crazy, and sometimes painful time. Wendy?
Thank you, Governor Reeves, and thank you for having us here today to talk about and share information on how to stay mentally healthy during this pandemic and how to access resources if needed. We appreciate you highlighting mental health at several of the previous briefings as well, and encouraging people to make sure that they take care of both their physical health and their mental health. We know that 1 in 5 Mississippians will experience a mental illness during their lifetime. And we know that 1 in 25 Mississippians will experience a serious mental illness during their lifetime, like bipolar or schizophrenia. Knowing these numbers, mental illness is common. It's common, but it's not often talked about. People across the world right now are experiencing fear, anxiety, depression, hopelessness, sadness, anger, all due to things that are revolve around this COVID-19 pandemic. But it's important for us to remember that everyone responds to stress differently. There is no right or wrong way to respond to stress. Everyone responds to it differently, and we have to make our mental health a priority. Stress during an outbreak like this can include fear or worry about your health, fear or worry about the health of your loved ones, anxiety from loss of employment. It can be changes in your eating or sleeping habits. Maybe you're sleeping too much or you're not getting enough sleep. Maybe you're eating too much or you're not eating enough. Sometimes we can see this also in increased use in alcohol and substances. And also we can sometimes see an overwhelming fear of hopelessness or helplessness. But there are ways that you can cope. For example, sometimes we may need to step back from social media and all of the stories about the pandemic and give ourselves a break, taking care of our body and connecting with your faith, also trying to eat healthy, well-balanced meals and exercising regularly, and connecting with others. Governor Reeves spoke about social distancing. It has saved numerous lives, but at the same time, social distancing does not mean disconnecting with everyone. Making sure that you stay connected with your loved ones and you talk about your concerns and how you're feeling. But if your feelings start to impact your ability to function each day, we want you to know that you are not alone and that help is available and that there are resources. You know, when you have a health condition such as a cold or a broken bone, we don't hesitate to reach out to our primary care physician. But when you need to reach out to someone for your mental health, sometimes it's not quite as easy. And that may be also because you don't know where to go. You know, Mississippians are known for taking care of their neighbors and for being the hospitality state, which is absolutely wonderful. It's why I love to live here. But at the same time, sometimes we always want to make sure that everyone around us is okay, and we forget about taking care of ourselves. Self-care is not selfishness. Self-care allows you to take care of others. So it's important to give yourself some credit and celebrate the small wins. Check in on yourself. Make sure you're doing what you need to do to stay mentally healthy. Eating right, exercising, taking the medication that you need to take, and also making sure that you communicate and talk to those around you. There are a lot of resources that are available in our state. It's important that we don't ignore our own emotions and our ability to cope with this during this time, and that we reach out to those resources when they're needed. Back in March, the state of Mississippi, the Department of Mental Health, launched a website called mentalhealthms.com. And this is a comprehensive website to serve as a hub of information. We know that a lot of times the reason people don't get help is because they don't know how to find that help. So you can go to mentalhealthms.com, you can click on Find Services, and it's going to pull up a map of the state of Mississippi. You can select your county, and it will pull up mental health providers in your local area for both adults and children and youth. Another great thing about this resource is it has personal stories. Sometimes we want to hear from somebody who's been experiencing what we're experiencing, to where we know it's okay to talk about it. So you can go to this website and you can hear personal stories of people in Mississippi who have a mental illness and who want you to understand that recovery is possible and help is available. We also have a website called standupms.org. This site was developed in response to the opioid crisis, but it has a treatment locator to find providers in your area that provides substance use treatment. We know in any time in a pandemic or economic situation, we do see increases in substance use, and we want people to know how to access that treatment. We also have mobile crisis response teams in our state. Mississippi has mobile crisis response teams available in all 82 counties, and that service is provided by your local community mental health center. So you can go to that website, mentalhealthms.com, and you can find your mobile crisis response team. They are available 24 hours a day, 7 days a week, and they come to you wherever you are experiencing that crisis. The Department of Mental Health also has a helpline that's available on that same website. It's 1-877-210-8513. That website and that telephone number, that helpline, is available 24 hours a day, 7 days a week to connect you with resources in your area. There's also a national distress line that's through the Substance Abuse and Mental Health Services Administration, and it's called the National Disaster Distress Line. They have trained crisis counselors available 24 hours a day, 7 days a week, that are specifically dealing with responses to COVID. Also during this time, we know that we are seeing an increase in the number of calls to the National Suicide Prevention Lifeline. If you look at the calls in February to the calls in April, we've seen about a 20% increase in Mississippi calls to the National Suicide Prevention Lifeline. So we want to make sure that everyone knows that that resource is available. It is 1-800-273-TALK. 24 hours a day, 7 days a week. You call that number, you will be connected with someone in your state, in Mississippi, to talk to you if you are having thoughts of suicide. You know, it all starts with empathy, as you mentioned, caring, listening, and support, and realizing that during a time like this, we need to support our neighbors, and we need to make sure that we take care of ourselves as well.
Thank you, Wendy. That's again mentalhealthms.com. Please feel free to go online and make a phone call should you need to do so to either one of those lines that Wendy had given us. I think we also need to recognize that government alone cannot solve these problems. And in some instances, even mankind cannot solve all of these problems. They are a consequence of our imperfect world. And the best way I know to deal with them is with faith. Of course, not everyone shares that faith, and this is certainly not to isolate those people. But I wanted to ask a friend of mine and a faith leader who has been instrumental in providing help to the community during this time to share some words of encouragement and hope with everyone this afternoon. That friend is Pastor Cameron Tate with Bridging the Gap Outreach Ministries here in Jackson. Pastor?
Thank you, Governor. What a privilege it is to be with you this afternoon. I want to remind us of a few things as I have personally been processing what this time has meant. Our state has been hit, and the world has been hit with some very unforeseen circumstances. And I'm reminded as I go back to Scripture, in Psalms 34:18, it's recorded, "The Lord is close to the brokenhearted, and He rescues those whose spirits are crushed." I'm reminded there are seasons in life where things come upon us that is a result, like the governor said, of a fallen world. But there is hope. And there is hope in a person, and his name is Jesus. And so I want to encourage all of you out there today to turn to the Lord in a moment like this. Please turn to the Lord in prayer. Please turn to your word. And please begin to reach out to your pastors or other locals in your area who are concerned and who love to call on the name of the Lord. I believe in moments like this in 2 Chronicles 7:14, when God reminds us that if we call out to Him, then He would hear our prayers and He would heal this nation. And that is my prayer, is that you would find hope in the promise that God has a plan. And so I want to remind you to be in the Word. Some churches have begun to reopen. A lot of churches are doing things virtually through Zoom and other means of media. Please begin to use that as a resource to you, whether it be via Facebook or via Twitter or Instagram or however you connect. But please stay connected to the local body of Christ. I believe in a moment like this, we all need one another. I believe this is the time that the church must stand together and be of help and a resource to people. One of the things I am so blessed about living in Mississippi, and as I've had the privilege to travel all over the state and preach the good news of the gospel, is I've seen so many churches and pastors with hearts who are ready to help. And so just a few of them, we will go in downtown Jackson where my friends David and Amy Lancaster serve there. They are always willing and ready to help the community. They've been down there for over a decade now. And so I encourage anyone with any sense of worry or concern or fear to go speak to my friends Amy and David Lancaster. We will go. They distribute food to the community. They give hope, they give grace, and they give love. Also, there is the Gateway Rescue Mission, the Good Samaritan Center, and Salvation Army, which covers physical and spiritual needs. And so we want you to know that as a faith leader in this community, I am praying personally for you and your household and your family at this time. We know that it is not easy, but I want to remind you, there is a light at the end of the tunnel. I want to remind you that after every tragedy, there's always deliverance. So I'm standing with you. Stay encouraged, stay in faith, stay hopeful, and know that God will get us through this. God bless you.
Thank you, Pastor, for your wonderful ministry and your passion for the people of Mississippi. It is very obvious to any and everyone that is paying attention today. Wendy, to you and y'all's entire team at the Department of Mental Health, thank you for what you do for our state. I am so honored to be the leader of a state of people who care about one another. And I sincerely appreciate the work that is going on, to have the opportunity to come before you today and expand upon our normal topics here in these daily press conferences, and to have Pastor Tate and Wendy here is something that means a lot to me, and I know it means a lot to the people of our state. So thank you both. Thank you very much. And at this time, I'm going to ask give us 2 seconds to change out. We're going to get Dr. Dobbs up here and Matt to talk about COVID-19. So thank you very, very much. I'm going to turn it over to Dr. Dobbs. We did not have a press briefing yesterday, and I think that worked out good, as we had a few challenges with the technology, but Dr. Dobbs is here to give us an update on what's occurred over the last couple of days.
All right, thank you so much, Governor, and thank you all. Today, the Department of Health is reporting 608 additional cases. Now, keep in mind that's for 2 days. So for up through last evening at 6 p.m., we have 608 additional cases for Wednesday and Thursday. That brings our total case count up to 19,091. We are also reporting, sadly, 13 additional deaths, bringing our death total up to 881. We have had several questions about the mortality rate based on race, and when we broke it down, we do find something that we discussed previously is the high rate of disease and mortality among Native Americans. And if we look at the case rate among Native Americans, it's 1,585 per 100,000 in Mississippi, compared to 834 for African Americans, and for Caucasians 282. So almost an 8-time increase mortality rate. If we look at the case rate. If we look at the mortality rate among Native Americans is 174 per 100,000, compared to a mortality rate of 39 per 100,000 in African Americans and 21 per 100,000 in Caucasians. So much, much higher. So Native Americans are much more likely to get coronavirus, and then when they get it, they're much more likely to die. That same sort of pattern holds for African Americans, although not at the same degree. Additional information that someone had requested last time were how many case investigations do we receive and close out on a daily basis. So for Wednesday, I have a final report that we started 314 new case investigations for the 10th, and on that same day we closed 301 contact tracing investigations. So that's sort of like the daily churn as an example, but it varies day to day as you might expect. And on that same day, we did 46 health facility notifications. So if someone worked in a health facility, we contact them and make sure they know that there is a case and what steps they need to take. There were 34 workplace notifications, and we had 17 interviews that required a foreign language interpreter. If we go on to hospital status, we have currently 486 patients in the hospital with coronavirus, 171 on intensive care unit, and 94 on mechanical ventilation. We are continuing to distribute remdesivir, the investigational drug that has shown some promise. And we have distributed it to 40 hospitals, and we have additional supply, and we'll continue to distribute that through our state public health pharmacy to hospitals that have patients who qualify for its use. If we look at testing, the Department of Health has conducted, in concert with others, including UMC and the National Guard, 287 unique test site locations, including 195 outbreaks. So we're very, very busy on all fronts, and we're keeping that up. For this weekend, Saturday, we have a test, available drive-through testing in Bay Springs at the Jasper County Emergency Operations Center, and in Kosciuszko, the Atala County Coliseum. Strongly encourage people to take advantage of this. If you have any symptoms of coronavirus, if you feel like you have the cold or cough or congestion or shortness of breath, please avail yourself of this opportunity. It's cheap, it's fast, well, it's free, it's pretty cheap. And then on Monday, we have a testing site in Port Gibson at the Claiborne County Park and Rec, and West Point at the West Point Civic Center. And that's all I have, Governor. Thank you.
Thank you, Dr. Dobbs. Just to reiterate, this weekend on Saturday, the testing centers will be in Bay Springs and Kosciuszko. On Monday, I understand they'll be in Port Gibson and West Point. If you feel like you would like to get a test, get a test. When in doubt, get a test. We have significant testing capacity in our state, and we are continuing to try to test anyone who would like to receive one. With that, I'm going to turn it over to Mac, who is sitting in today for our Emergency Management Agency. Mac, it's all you.
All right, sir. Thank you, Governor. I want to continue on with what our original theme was, is that even during our natural disasters, FEMA has opened up their crisis counseling line as well. And that is super beneficial to those people who not only with COVID, but have experienced even more of the damage and disasters that we've had during the state. I'll go more on that toward the end of my brief. But looking at what we're currently doing in the COVID environment, along with our partners, we couldn't do it without on the Mississippi Department of Health and the National Guard and other state agencies who are out there assisting us to do those things we need to do. We continue to receive about 67,000 gowns yesterday. Our medical mask, another 400 boxes of those, thermometers, as we're getting into the election season and other things, and turning back on governmental agencies. About 1,600, and as well as we received 317,000 face masks yesterday, and that's been one of the areas that we've definitely been deficient in, but we've been able to ramp those things up with our acquisition team that has come on to MEMA to do that. If you look at what we actually did in deliveries yesterday, breaking it down by gloves, mask, disinfectant, you name it, all those items that are needed to protect workers that are out there on the front line. We delivered over 582,000 items to 26 healthcare facilities, Tier 1, all of our county pods, 9 different areas that support the 82 counties and the Band of Choctaw Indians, as well as the governmental agencies and the critical infrastructure facilities that we have out there. So we continue to do that on a 5-day basis. We've traveled over 130,000 miles doing those deliveries, as well as the hot shots when we have breakouts and whatnot. And I can't say enough about the 50 Mississippi National Guard citizen soldiers that are out there making that happen, helping us run that warehouse, helping us gain that supply acquisition, and also getting those items delivered, even though you have a set delivery route, diverting and making sure we get to one of those hospital care facilities that need it. Moving on to need to remind everybody that June the 15th, Monday, is the deadline for the SBA registration and FEMA registration during our past events. So we've put that out on a daily basis. We've definitely put it on Facebook, on our website, et cetera. Our registrations are dropping off. We think we've really done a real good job able to do that, and I'll report those numbers out in just a second. Looking at just the April 12th storm, we have got $5.2 million that we've put out in the individual and households program. So when you break that down, if you look at the area of home repair, rental assistance, replacement, and lodging expense, that is $4.3 million have been acquisitioned and given out to those survivors that need the assistance. In the other needs assistance areas, and it might be medical, moving storage of their private property, and transportation and some other needs, we've put out almost $950,000 into that area to those folks that need it. And SBA itself, with homes and businesses, they've been able to approve and get refinanced and help individuals with $7.4 million. So there's been definitely a great push. I appreciate our FEMA partners that provided some of the guidance and a lot of the heavy lifting to get those services down here, to get them turned on. We did it virtually. And this is the first one that we've actually done almost totally virtual, from damage assessments all the way to getting all the supplies, the funds, and everything needed to the site. So it's been a learning curve for all of us, but we've definitely been able to get that out there to everyone. In the three counties down there, Jefferson Davis, Covington, and Jones, I want you to think about, we have removed over 659,000 cubic yards of debris. Okay, what is that? Well, what does that look like? If you look at your stove at home, 3 foot by 3 foot by 3 foot, that's a cubic yard. But let's talk about 200 Olympic-sized swimming pools. That's how much debris has been removed off the side of the roads and from those impacted areas. And that's a huge task within itself, getting those things that are rotting, you name it, and also the debris off the roads, clearing them up for emergency traffic, for ambulances to be able to get people to medical health and everything else. So it's been a yeoman's job down there. Those emergency management directors are working every day hard and in the depth, and I just can't thank them enough for just plodding forward and getting that area looking very well. We continue to support Cristobal that came through. We did get a state of emergency, and our local three counties, Jackson, Harrison, and Hancock, have been doing their damage assessments. We currently have 22 roads, public roads, about 10 public buildings, about 14 homes that were affected, and about 10 businesses. The beaches, we have a lot of debris that was brought up onto there, including Nutri-Rats and straw and hay, and so it is that is a experience within itself. We had that during Isaac. That is a health problem for us. So we're definitely supporting them in getting their acquisition of supplies and stuff in there to get that removed. So that is ongoing with that assessment, but those three emergency management directors are doing a great job. What seems to be lost sometimes is, let's think about the rest of the state. What about the backwater flooding? It's something that we don't visit back to, but I get a report every day on it. And we're backwaters at 91.5 feet, and that is 322,000 acres that are totally flooded right now, and 91,000 are cropland. Well, that means crops aren't being produced. That means some type of food source is not being produced. So you look at what is that impact really. So for 150 days, it's been above 87 feet, and that affects those croplands. For 146 consecutive days, it's been above 90. And for 83 consecutive days, it's above 94. So that is a serious impact within that Delta land and Delta property. I'm proud to say that we now have the Braille Spanish versions of our hurricane guide, and also Vietnamese is online. So we've been working hard and heavy to be able to contact and deliver a service to every citizen that's out there. It doesn't matter what walk of life you come from. We want to be able to be there, and also to give you a way to be safe and to have a good plan as well. I do want to talk about, since the governor and I have been working together real close for about the last 2 years, I thought I'd put together some facts that during the last 18 months of 7 federally declared disasters, and I have 2 more that are probably going to get declared. That is the April 22nd, 23rd event. We requested that, as well as Cristobal now. One-time declared counties during that time frame, about 18 months, 21 counties were affected. Counties that got affected twice was 24. Counties that got affected 3 times by federal declarations are 17. Counties that got affected 4 times were 2, and then one county got hit 5 times. I'm gonna call them out. Clay County, you got 5 federal disasters in 18 months. So if you look at that number, 68 counties and the Band of Choctaw Indians, that's 83% of the counties and the people in the state of Mississippi who have been affected by a federal disaster either 1 to 5 times over the last 18 months. And I didn't even throw COVID in there. So if you add COVID in, that impacts the entire state. We are resilient. The state of Mississippi does an excellent job. If you looked at the low, what I call low crystal ball numbers, the 14 homes, the businesses and whatnot, that goes back to mitigations, the lessons we learned from Katrina and others, rebuilding harder, rebuilding those necessary services that need to be turned back on quickly. And I hate to say it, Governor, but we've gotten good at it. And but that goes to the hard work of the first responders, the EM directors that are out there on the front line, and then of course we support them on a daily basis, and the state agencies. MEMA does not do it alone. Our Emergency Operations Center has about 25 to 30 desks down there. You've seen it, sir, and it is filled with good men and women in the state of Mississippi from other state agencies that come and help us coordinate the things that the state does. Sir, that ends all my comments.
Well, thank you, Mac, and I want to personally thank all of the agencies, some of whom report through the governor, many of whom do not report through the governor, that man the space at the State Emergency Operations Center. It is incredible to see, and we have been fully functional and fully operational, basically 24 hours a day, 7 days a week, probably for the last 4 months. And I want to thank every single individual that has helped us with that. I also want to thank their families, because I know that your loved ones have been gone because they're standing up to do what's right to help their friends and their neighbors throughout our state. And I want to personally thank every single one of you. This has been a challenging time for our state, but we know in Mississippi when times get tough, it's the tough that get going. And we've got an awful lot of Mississippians that have worked their tail off for many, many, many months, and I want to personally thank you for that. So with that, I'll open the floor to questions. Courtney?
If we could for a moment go back to mental health. I know early on there had been concerns, and you all referenced it to some degree, that folks perhaps wouldn't reach out. Do we have any kind of numbers or percentages on how many, maybe an increase or not, of people who have reached out to the state? I know we heard about this National Suicide Hotline, but has there been an increase in folks reaching out to?
I would say, just anecdotally from what I've heard talking to other governors, that we have seen significant upticks across the country. I don't have any specific numbers, but I know Wendy's still here, and we'll try to get those numbers to you really soon after this briefing.
Hunter Dawkins with the Gazebo Gazette has a question. Hunter?
Thank you, Renee. Thank you, Governor. 2 questions for you, Governor. The first one would be, I hope you remember the hypothetical question that I asked you on Wednesday. Well, this hypothetical is actually turned into a reality as the bill passed the Senate, even though it was amended, so I'm not necessarily sure if there's going to be a conference or not. But with HB Bill 827 giving the power of the DMR sole authority to the executive director, I would like your opinion on that. And also, the second one would be the Go Mesa funds here on the coast. What have those been being spent, or is that in the process of happening anytime soon? Thank you, sir.
Thank you, Hunter, for those questions. I was alerted by the leadership in the Senate that they had made some changes to the bill that you were referencing with respect to the Department of Marine Resources, and that bill was headed back to the House of Representatives. And the House will either concur with the changes that are made in the Senate, or they'll send the bill to conference. And I look forward to working with them. As I mentioned to you on Wednesday, this is not my bill, but it certainly makes sense in some respects. I've always believed that you've got to have accountability in every state agency, and so this is certainly an attempt at doing so. Again, there's a lot of details yet to be worked out, and we'll work with the members of the legislature to make that a reality. And your second question was with respect to the Go Mesa funds. We are actually, I believe, the Department of Environmental Quality and the Go Mesa Task Force and their group has made recommendations on funding projects. Some of those projects have been funded, and I know that there will probably be an announcement about an additional project in Hancock County that gets funded relatively soon. We've been working to get those things done. There's obviously a significant amount of resources out there, and we're going to continue to work to get those Go Mesa funds done. Joe?
Dr. Dobbs, do you have a breakdown on the positive cases for the past 2 days, or just all lumped together? Speaking of, do you have the number of positive cases that would have been reported on the 10th and the positive cases? And could you tell us those numbers?
Yeah, well, I don't have them in front of me, no, but when we post them, it'll be parsed out in the data by those dates like we do on everything else, and so that'll be there. But I do want to, now that you mentioned that, I just want to bring up a point, because we do get innumerable media requests, very specific things that folks are interested in. And one of our challenges has been we are working with sort of a legacy software system that wasn't equipped to deal with 250,000 records. And each one of these cases, it's linked by individual case. It's not linked in a larger format such that you can just print a spreadsheet of this, that, or the other. We have to run detailed queries to pull out different bits of data. And so we do this for the things that are important. It's still labor intensive. And so, we're going to, work on this and make sure whatever resources we have to do to apply to get that, we feel good that not only are we going to have a path forward, but we also have both contingency plans if we have additional problems.
Thanks, Renee. I've got a question for Dr. Dobbs and Governor Reeves. There are several new scientific studies out. One, Dr. Dobbs, you tweeted this morning from the UK, and another one from the US National Academy of Sciences journal about how social distancing alone is likely not enough to prevent community transmission, but mandated masks in addition to social distancing together were shown to effectively curb the spread. I know y'all both have been pretty adamant about encouraging masks, and some businesses are requiring fewer for employees and patrons, but with the hospitalization spikes we're seeing and ongoing community transmission, is there a point where y'all will think policy will need to reflect this ongoing new evidence and perhaps mandate masks in the community?
Yeah, so, this is something that we've really been promoting for a long time, understanding that it's an effective and easy way from a population perspective to slow the spread. And one of the things that was really interesting, if you read into the details of the study from the UK, it basically says that if we are pretty comprehensive in our mask use, not 100%, but 60, 70, 80%, then it can keep from having to do shutdowns. And that's such an important factor, because it's been conflated with masks are closing business, and that nothing's further from the truth. Masks keep businesses open, and there's a lot of good references in there that helps understand why that works and why it's useful to do it. The flip side of getting people to do it, Mississippians are by nature in many places an independent sort of people, and I think in a lot of ways that we have an opportunity to be even more successful if we convince than push folks to do it who don't want to. Whenever I look at the Clarion Ledger and I see a crowd of people in Mississippi, I see a ton of masks. And so I'm just really proud of my fellow Mississippians who understand that it's not about me, it's about my neighbors, it's about my community, it's about my state, and it's about keeping my state's economy running. And it's a selfless act. It's a beneficial act. If you wear a mask in public, it helps us all.
Thank you, Dr. Dobbs. And I would just echo that. One of the things that we have found throughout this process, and of course I use the story from our pastor friend down in Adams County as a prime example. When his government told him he had to shut his church down, he was not really interested in complying. However, when I called him and asked him to please protect his flock, he immediately said, I will do exactly that. And so we think we can get more compliance by encouraging people. We think that there is no question that if you will maintain social distancing combined with wearing masks, it will slow the spread of the virus. It will significantly reduce the likelihood that occurs. Now, we have mandated certain things, for instance, in restaurants. We have mandated masks for servers. You've heard me say this because I've said it this week, but I was down on the Mississippi Gulf Coast all weekend, this past weekend during Cristobal. My wife and I had attended 2 restaurants while down there, one in the Kill, one in Pass Christian. And I will tell you that those are the first 2 restaurants I had been at since the 1st of March. And in both instances, and I didn't necessarily tell them I was coming either, but in both instances, every server had on a mask. And those are the little things that we can do that will protect us and that will minimize the spread relative to what otherwise may happen. And it allows for those restaurants to be open. Because if we could not ensure that we were having compliance, it would be harder for us to make the decision to allow for those restaurants to be open. And so we know that so many Mississippians are doing everything they can to comply with not only our mandates, but also what we're urging and encouraging people to do. And we believe that that's going to continue to be the case. But it's not over. It's just not over. If you look at the total number of cases that we're going to have, and I haven't seen the 7-day moving average in the last 48 hours because while I saw the number of cases this morning, I haven't seen the 7-day moving average, but we're going to be at or near an all-time high. We know that. That is not surprising to us as we continue to increase testing capacity. We're going to find more cases. We tested a lot of asymptomatic people with various testing maneuvers over the last month or so, but that also tells us that as we reopen the economy, as we get more and more people back to doing what they believe to be more normal, we're having more cases. And so because of that, it is incredibly important that every Mississippian do everything you can to maintain social distancing, to wear a mask, to limit the size of groups, whether you're at a restaurant or doing a social activity. It's just critically important as we get through the next 4 to 5 to 6 months, and hopefully at some point we'll have better treatment and hopefully even a vaccine, but we're just not there yet. And so please, please, please continue to stay vigilant, because I don't want to be in a position where our health experts who have been incredible throughout this process come to me and say we really need to try to shut down some segment of the economy, because that is not something that I am interested in doing. But we've got to let the data drive the decision. So please, to my fellow Mississippians, be smart. Wear a mask. There is nothing wrong with wearing a mask when you go to the grocery store. There's nothing wrong with wearing a mask if you go to a retail store. Please, please, please do so.
Dave Elliott with WLOX has a question.
Thank you, Renee. This for either the governor or Dr. Dobbs. Mississippi has been included on a list of states with a number of cases over the last week that could be called alarming statistically. What these states have in common is all of them have aggressively reopened the economy and allowed more freedom of movement. And then you throw in the Memorial Day weekend 21 days ago. Do you fear there's a direct correlation there?
My personal view, and I'll let Dr. Dobbs speak from an expert medical opinion, I'll just speak from a expert politician's opinion, I guess. But I have watched this fairly closely for a number of days and weeks and months. But my personal view is that yes, as more and more people get out and about and do things that perhaps they weren't doing 2 or 3 months ago, there is certainly a correlation between that activity and the number of cases. Memorial Day weekend is certainly something that we point to, but that was 3 weeks ago. Let's not forget that we went through a 10-day period in this country in which we saw thousands and thousands and thousands of individuals exercising their First Amendment right to protest their government. And in many instances, these were very large crowds in very close contact with one another, and that's going to have an impact as well. And so, I think when we look at the overall goal that we have as a state, we have said from the beginning our number one goal in all of this is that every single Mississippian that can get better with quality care receives that quality care. And so hospitalization and utilization rates of our hospitals, of our ICU beds, of our ventilators are critically important. And so far, even with the cases not declining significantly, and I would certainly argue that we certainly hadn't seen a spike, we have seen a very slow, steady increase in total cases over time, but we haven't seen the huge spike that you saw in New York or New Jersey or Connecticut or Louisiana. But yes, as more and more people move around, if more and more people move into contact with one another, I do think it is correlated with additional cases.
Yeah, I agree entirely. We have seen some augmentation in cases, but it hasn't really been a spike. It's been sort of a creep up, and certainly some of that, I certainly do think it's because of people letting their guard down, essentially. But I would like to also contrast it with some of the other states that we're talking about, especially Florida, Texas, Arizona has had a massive increase in cases, even Utah and Oregon, and we haven't seen the same sort of degree of increase that some of these other states have had. And I would like to just mention that when we were talking about the different sort of pathway to lifting restrictions, I was inundated with phone calls, as you can imagine. And then a lot of those phone calls and in verbatim, it's Florida's doing this and Texas is doing this. Why can't we do it, right? They're not going to put restrictions on summer sports. They're not going to do this. They're not going to do that. They're going to allow full stadiums and all that kind of stuff. There's a measured, wise approach that will keep us from getting in trouble, and that's certainly, I think, the needle that we're trying to thread.
Hunter with the gazebo has another question. Hunter?
Governor, thank you. Renee, Governor, thank you very much again. Just two final questions for you, Governor. This would be about education. Earlier on this week, you signed some bills about the education, somewhat about the licensure for a teacher shortage and things with that. And if you wouldn't mind explaining that. And the second question would be, is there any talk been with Dr. Wright about the opening of schools, the timeline that you guys may have?
Well, thank you for those questions. I'll answer the second one first. I have not personally spoken with Dr. Wright about the reopening of schools. I have talked repeatedly with the chairman of the board, Dr. Jason Dean, about reopening of schools and other things as well. And I know Dr. Wright and Dr. Dean and my staff have worked very, very closely for many, many months on end. And we are continuing to look and see as to if there is a reason to change the timing. We tend to act as a state in such a way where we give the locals as much autonomy as possible. We tend to let our local school superintendents make those decisions, unless, of course, it's of a nature like we had this year where we had to actually shut down all schools across the state of Mississippi. But I would anticipate that schools would reopen at a time, if I were a parent and trying to plan, I would anticipate that most schools throughout the state of Mississippi are going to reopen at about exactly the same time that they would have reopened had COVID-19 never occurred. And I will also tell you, it is my understanding and my impression that there are many school buildings that have reopened. There are summer school classes in some instances that are taking place. We have reopened where some kids can get back in the gymnasium as long as they adhere to certain rules as we have put in place. And so my expectation is that would be the case. In terms of the bills that I signed this week, we actually had 10 bills that reached my desk. I signed all 10 of them. I will tell you, I don't think any of them are going to change the course of history in Mississippi, but they did pass both chambers of the Mississippi Legislature, and I did sign each of them into law. With respect to the bill, I believe that you're talking about in terms that deals with the teacher shortage. Much of that was really just an extension of the time frame under which those laws that were put in place that came up for reevaluation. They just extended the deadline, and so that was something that I certainly support. I was supportive of the things that were put in place to help with respect to our teacher shortage. And I will tell you, with respect to teacher shortages, I do think we have a unique opportunity in the light of COVID-19 and the fact that we did have a significant number of our students throughout Mississippi that were practicing distance learning. That really, if we as a state will embrace that, if the education community as a whole will embrace distance learning and recognize that we could have one calculus teacher that taught calculus classes all day, every day from a central location, and we had the adequate technology such that we could put that calculus teacher in classrooms in 6 or 8 or 60 or 80 different schools across the state, then I think that opens up opportunity and access to high quality classes for more and more students across the state. And so, and I think it helps us in terms of reducing the amount of challenges that we face in terms of teacher shortages, particularly in those districts that are more rural, that are harder to get to, and in some instances have less local funding. And so that's something that I think you'll see and hear a lot of conversations about in the future, because I think it's really, really important.
Erica with Mississippi Today has another question. Erica?
Thanks, Renee. One more question for Dr. Dobbs. I attended the Mississippi Public Health Association annual conference last October where you spoke. You talked a good bit about the role of social determinants in shaping health outcomes and disparities, including chronic stress and poverty, things we talk about a lot, but also racism and bias in the healthcare setting that you called their own public health issue, like we've also seen in some of the Jackson Heart Study findings. In light of COVID racial disparities and this sort of moment of reckoning in the nation right now around police brutality, some states like Ohio are considering, and some cities have already declared racism explicitly as a public health crisis. Do you see systemic racism as a public health crisis in Mississippi?
Yeah, without a doubt, and we're all from Mississippi, we know our history, and we know the impact that that's had on generations of people who have lived here. From a scientific perspective, we know that there are numerous levels of impact on minority communities, and especially the black community in Mississippi. I mean, part of it's going to be economic disparities that give you lack of opportunity. It's going to be segregation in the schools, and then the translation of that into the future. Even beyond that, though, and all that certainly feeds into health disparities, it's well known that institutionalized racism, racism as it is understood by those who are offended, it has very bad health impacts. It worsens cardiovascular outcomes, increases blood pressure. This is not surprising at all, is a part of the reason we have some of the health outcome disparities. So yes, racism is a factor in health, and racism is a factor in public health. And it's something that the agency, we have kind of strengthened our health equity office. We are reinvesting in that and have been well before this. And combating health disparities with all the sources, whatever they may be, is a commitment of the Department of Health, and it will continue to be as we go into the future.
Yes, sir.
For Governor Reeves, in the 1995 and 1996 issues of the Bogalicia, which is the Millsaps College Yearbook, there are pages attributed to each Greek organization, and on the pages attributed to the Kappa Alpha Order in those issues, large group photos and the members are dressed in Confederate grays, and in the 1996 issue, a member can be seen holding a Confederate flag. This is presumably part of the KA tradition called Old South, a party in which members dressed as their dates dress in antebellum garb, which can be seen as a practice in the fraternity for decades. Composite character photos and adjacent pages confirm that you were a member of the Kappa Alpha Order for those years in the pictures, and I have two questions for that. As a member of Kappa Alpha Order and your participant, were you a participant in those traditions, and did you wear Confederate grays? And considering your reluctance to take a personal position on the current Mississippi flag outside of deferring to the 2001 referendum, how can you assure Mississippians that you are capable of leading them through this difficult moment?
So I can confirm that I was a member of the Kappa Alpha Order. I can confirm that I attended a large number of costume parties throughout my collegiate career, as did tens of thousands, if not hundreds and hundreds of thousands of Mississippians and, quite frankly, of Americans. What I can tell you about leading in this moment is this. I made a commitment to the people of our state during 2019, for many years before that, with respect to the Mississippi state flag. I have to consider not only the current moment, but how we bring our state back together long term in the event that Mississippians choose to change the flag, and I think at some point they will. But it has to be done by a vote of the people. It cannot be done by a backroom deal by politicians in Jackson, because once it's over and done with, it has to be done in such a way that all Mississippians get on board, that we come together, we do the things that we were talking about earlier with respect to Mississippians stepping up and helping one another in these challenging times. And I believe that the right way to do that is for the leaders of this state who have made a commitment to the people, that they honor those commitments. I think that's incredibly important. Thank you. See no other questions. Thank you all very much. Have a great weekend.